Welcome to UNCAGED. Today we're speaking with Cale Queen. Cale, it's great to have you on the show.
Yeah, it's good to be on the show.
Now, Cale is the founder and CEO of TriStar Business Intelligence, which is a consulting firm that helps healthcare organizations strengthen operations through business intelligence, operational strategy, and practical data-driven decision making. And before the show, Cale and I were talking a little bit about the difference between literally dashboards and measurement and actually real intelligence. And so I'm excited to get into that with you, Cale. But before we get there, let's talk a little bit more about you. Tell us a little bit about yourself and your career.
Sure. So I started off many years ago as a medic in the Army, worked in the emergency room, and then transitioned over to healthcare operations and leadership. I was in the National Guard for 23 years, and I left as the senior medical operations planner for the state of Tennessee's National Guard. I commanded the COVID task force, which responded to the COVID crisis. On the civilian side, I've worked in every level of healthcare that you can imagine. I did performance improvement for HCA for a number of years. I worked in their traveling teams. I did everything from fiscal to clinical outcomes, and how can we take data, understand it, and create change inside the organization so that you have a real impact. And so I did that for almost 10 years. I've been executive director of some clinics, and currently I'm just trying to bring what I did to for the Army and for TriStar, bring all of those lessons together into a single company and a single operation and a consolidated process to help clinics use their data to make better decisions so that they can thrive in the changing markets that we see today.
Well, let's dig a little bit into that, Cale. And firstly, obviously, thank you for your service. And I'm excited to go into the whole TriStar Business Intelligence story here. Now, tell me a little bit about how you and the team approach problems, and how do you get to that real business intelligence?
Yeah, I love it. Actually, I think the problem with business intelligence is people think it's something new. It was actually coined in 1865. So before the first computer, before the first PowerPoint or spreadsheet, there was business intelligence. And it was used to describe a banker who was able to read the market, look at the pressures, look at the politics, and always seem to make the right decision. And that's what I view business intelligence as being today. It's taking it back to that understanding the environment. So we take a look at everything. What is the political pressures in your area? What are the regulatory requirements? What are your payers, ages, mixes, disease types? All of those factors come together to really define the market that you're operating in. And once you understand the market you're operating in, then you take a good solid look at the internal processes. Are your processes aligned to help you in your environment, or are those processes like in opposition? And so are you butting into each other, or are you blending? And that's where we find a lot of opportunity, is just in that, how is my internal process aligning, helping me thrive and survive in today's environment? And I look at a lot of great lessons from Lean and Six Sigma. I look at change management theory from everybody from Chip and Dan Heath, Four Disciplines of Execution, David Marquette's Turn This Boat Around. They all say and mirror a lot of the same thoughts, and that's understanding why people fear change, how change is difficult, and helping them see the picture. I like to talk about getting into the leading problem, right? What is the thing that is the root cause, the leading factor that drives the outcome? Pareto rule 80-20, right? That 20% of work that you're doing that's driving 80% of your outcome, and making sure that you're aligned well there. We then use, it's really just re-engaging with the fundamentals, the solid business practices that have thrived and survived for so many years because they're valid, We're just taking it and thinking about it from a data-rich perspective. We're using the data to help us inform and drive the decision. So you're really focused in on those key factors that are going to get you your outcome and your result. Once we know that root cause, then we're going to help you build an action plan that's sustainable. We talk about decision points. Everywhere along the way, everywhere along any action plan, any business of any size is done, you know that you're going to have to make decisions. You know that you're either going to have to hire, you're going to have to get more facilities, you're going to have to grow infrastructure, or if the idea isn't taking off in the market, then how do we control and mitigate that risk, that loss, right? Those are decisions. We know what they are. So we use those as our key performance indicators. What are those factors that I need to know as a business owner to make the right decisions at the right time so that I'm staying relevant with my market? The big challenge in healthcare is every healthcare executive I've ever spoke to talks about having a 3 to 5 year long-term strategic plan. They're like, you can't. Take a look at GLP-1, right? 2 years ago, it wasn't a thing. This year, it's the thing, right? Everybody wants to have a GLP-1. So healthcare transforms so quickly that it's hard to do that 3 to 5 year plan. But when we can bake it back down to, we know that we're going to grow our programs, we know that things are coming, how are we going to react to that? Is that even inside my business model, right? Like if I'm a cardiologist or I'm a family practice physician, maybe, but if I'm an orthopedic surgeon, do I need a GLP-1 line? Probably not, right? So you're taking a look at how am I going to reflect or react to, and that's the basis of that decision pointing as I'm going through my plan.
Yeah, I mean, I think that the thing that stood out to me, Cale, talking to you a little bit about the process that you put in place, is the difference between actionable change and essentially kind of like macro measures, measures that you keep it in. And maybe if you can elaborate on that idea, that'd be I think really clarifying.
Yeah, absolutely. I saw an interesting article the other day. It talked about CFOs and the amount of time CFOs waste in dashboards. And so because we can measure a thing doesn't mean that we should measure the thing, right? Every measurement needs to tie back to a decision. What am I going to do as a result of that? Does this particular metric drive something? I was working with a group today, and we were talking about their utilization of an outpatient procedure. And then there's a procedure that happens after this imaging test. Well, this particular practice has almost no use of the imaging. And so that led to the question of, well, why? Are they referring to another person? And so from a business intelligence perspective, the questions come into play is, well, do I have the volume to make it worthwhile to bring in something? So now you have a KPI, the number of people that are we are sending out to another vendor for this particular imaging. When that crosses this threshold, then we're going to want to, look at creating our own imaging lab inside our own process, where now I'm not giving somebody else revenue, I'm using the revenue. But below that threshold, it's going to cost me more than I'm going to make. So that creates a decision point. And then that's something that we can actually measure. How many procedures am I sending out versus how many do I need to have my own lab? And if I never cross that line, then it's okay. It's a smart business decision to continue to refer out. But once I start crossing over that line, then the dynamics of the relationship change, and that's when it may be worthwhile to determine, hey, let's open our own OP lab. So that's the kind of thing that we're taking a look at. The dashboard just reports something. It tells me a room is on fire.
Yeah. Well, I mean, Cale, the healthcare space is under just so many perpetual challenges. But when you talk and sit down with your clients, your customers, what are they thinking about right now? Like, what are like the key hot button issues for them?
Yeah, I think right now it's the present and the challenges in the present. So Every major insurer at the end of last year stated that they're going AI screening for reimbursements. And so that's the number one challenge. Every single time you send a bill forward, are you going to get down? Am I going to get down coded? Am I going to not get the revenue that I deserve? And that's a big deal when you spend 30 minutes with a patient, but because you don't annotate that you spent 30 minutes with them, or you don't annotate that you tracked a particular disease progress, or you modified a medicine, or you did any of these things that justify a particular billing code, you get downgraded to the lower billing code. So you did the work, but your documentation didn't match it. And so there's a lot of fear and concern around that. There's a lot of AI programs out there. A lot of physicians are looking at them, but there's a lot, they don't exactly do what the physicians need. And so they end up developing workarounds. The next biggest thing is, especially in adult care, is value-based care. 2036, Medicare's stated that it would like to have all of its patients in some kind of value-based care program. And on the surface, value-based care sounds great, right? What we're talking about is, instead of me seeing you and I order labs and et cetera, et cetera, et cetera, and I prescribe meds and I get reimbursed for the office visit, for the various things I do, the fee-for-service model, value-based care says that you're going to accept some risk in the outcome. And you're going to agree that you're going to do these particular steps, and that's going to improve this patient population's outcomes. It's going to reduce cost to hospitalization, emergency room visits, extra medication, everything else. The Medicare will spend less money taking care of the patient, and therefore we're going to share some of that money with you. But if you don't get that improvement, if you're not doing those things, then your reimbursements are going to go down with that too. And so there's a lot of data that's required to look at that. And there's organizations that are springing up to manage that. But that's a real business intelligence decision for healthcare as well, because you've got to understand your patient populations. You've got to understand what are the leading measures of care that are going to create that outcome, and that you can help a patient get to those so that you can improve the outcome and the cost of care goes down for everybody. It's a great idea. It briefs really well. It's just a lot harder to execute, especially for a small 1 to 5, 10 shop practice, right? That practice typically doesn't have somebody just set aside to run data analytics. They probably can't even really afford it. And so that's where you end up having to outsource that. Yeah. And that's where business intelligence can help those kinds of practices.
Well, I mean, Cale, you've worked in this space for a long time. And I mean, I guess, sometimes I look out at the healthcare sector and I get quite excited because I look at like some of the new innovations. I think like all of us, I was amazed at this stuff with the GLPs and how that developed. But at the same time, I work with so many healthcare organizations and they talk to me about shortages here and shortages there. And it just, it's always a stress, right? And there's always like these changes. Tell me a little bit about kind of when you look at the space, what keeps you kind of engaged and keep like coming back for more to solve these problems?
Well, one, I love problem solving. It's always been a thing that I get a bit of pleasure out of. But the other piece is, I feel drawn to healthcare my whole life. I started off as a medic because I wanted to help people directly. But then as I grew and developed, I learned that by building better systems, I could help more people. And so case in point, my first deployment to Iraq, I ran a battalion aid station out in the middle of nowhere, Iraq. We called ourselves the Little Fob on the Prairie, and we were about half an hour flight from any other base. And there I am. I've got 30 people. I've got two docs and a PA, and 30 some odd medics, and we're responsible for taking care of all of these people. And there were a lot of, when I first got there and we took over from another unit, there were a lot of challenges, and it all tied down to process. And so the answer, the first answer as a young leader was like, I need more people, I need more people, I need more people. But what I learned is I didn't so much need more people, I needed to use the people better. And so we took we took a long look at what are the things that are there. And so this is years before I was ever exposed to ideas of Lean and Six Sigma, before the downtime acronym, right? Defects, etc. Right before any of that came, I was exposed to it. But I was looking at that, like, what were the things that we were doing that weren't actually making a difference, but we were just doing them? What is the work that is being done for its own sake, and getting rid of it? There's a joke. This young soldier is standing guard at this bench, and the new general comes in, and he looks at him, he goes, "Why are you guarding this bench?" He said, "That's the orders, sir." And so he calls, the general calls the old general. He says, "Why do you have a soldier guarding that bench?" He goes, "I don't know. That soldier was guarding the bench when I got there." And so the general goes, "Huh." So he calls back, and he calls back, and he gets about 5 generals back, and he goes, "Hey, can I ask why you put a soldier guarding that bench?" He goes, "Don't tell me the paint hasn't dried yet." Right? And so we start doing something for a limited reason, but it becomes a pattern of practice and habit. And it's what we would call in the lean space non-value add work, right? You're doing it, but it doesn't add value to anybody in the way. And so as I started cutting out these things that we were just doing because that's the way it had always been done, I was getting back hours. And instead of just, like any leader, I'm like, okay, now I have these hours, I can allocate them to these other tasks. And I allocated them to the things that mattered, and results started getting better. We were able to get patients in and out of our sick call better. We were able to get better referrals to higher levels of care. Everything from like how we ordered helicopters in when we had serious injuries. We were like an hour and a half, 2 hours when I started. We were down to about 35 minutes when I left, and 30 minutes of that was just flying.
Wow.
Right? So you could take a look at the process and improve it. And that's what I think is missing in a lot of middle healthcare leaders. I love healthcare leaders. I wish we spent more time educating and investing in their development. Too often what I've seen is you get a nurse. My daughter's a PICU nurse at Vanderbilt, right? And she's a great PICU nurse. She does a great job of taking care of her patients. Well, they say, "Hey, you're such a great job of taking care of patients. Let's make you a charge nurse." And so we change her title, but we don't up her training. And so then she either thrives or doesn't as a charge nurse. And then we look at the charge nurses and go, "Hey, you're a great charge nurse. Let's make you a manager." And maybe we give them a couple of classes here or there. And so we keep doing that. We keep elevating people up and up and up the chain. And we don't really invest in their time and their education. And that's the one thing I found very different than the Army, where, hey, congratulations, you've been a captain for this long. We're going to send you to school for 3 to 6 months to learn to be a better captain, to get ready for your next mission, to get ready for your next thing. Hey, you're still with us. You're still great. We're going to send you to this school to teach you how to be on a general staff and teach you how to analyze and do things. Hey, you've been a great colonel. Let's think about making you a general, and we're going to send you to a war college, right? Like, and we do that with our sergeants too. Like every step of the way, there's institutional education, and I don't see that in the civilian healthcare arena. And I wish we did that.
Well, hopefully we'll get there, and I think it's all related to this fact that this is probably maybe one of the most dynamic spaces to work in. There's so many moving pieces. It impacts society on every level, and I'm excited to see some of these changes bear fruit. And move forward. But certainly, Cale, I can guarantee one thing, and that is that you will be a busy man because there's a lot to do. It's been great having you on the show today. If someone wanted to learn more about what you and TriStar Business Intelligence is up to, where's the best place to find you?
So our webpage is www.tristarbusinessintelligence.com. It's the best place to go. You'll see our our processes. We've got some books out there as well where we talk about revenue cycle management for small clinics. We talk about by exception briefing earlier. I go into greater detail with that. We'll be publishing our adaptive strategy textbook the beginning of April. So there's a lot of supplemental material that's there that you can take a look at. And obviously, if you're interested, we'd love to engage with you. Schedule a call. It's free, 30-minute consult, and we'd love to learn your problems and how we can help you solve them.
Very cool. Well, Cale, thank you so much for being on the show today. We've been speaking with Cale Queen. He is the founder and CEO of TriStar Business Intelligence. They are a consulting firm that helps healthcare organizations strengthen operations through business intelligence, operational strategy, and practical data-driven decision-making. Been talking to him really about what is real business intelligence. How can companies really grab that true intelligence and make it into actionable change? And a lot of times I think we get caught in that maybe that lovely loop of measuring things that matter, but maybe don't matter so much to affect change. And I think Cale really did a succinct and wonderful way of putting that into perspective for us today. Cale, thanks so much for being on the show, and we look forward to having you back.
Sounds great. Thanks.
Cheers.